Well, most of our patients increase their physical activity when they become involved with pulmonary rehabilitation. So there's a lot of evidence out there that pulmonary rehabilitation works. When patients engage in pulmonary rehabilitation, they increase their physical activity and their physical function improves, usually either measured by a treadmill test or by a 6-minute walk test. They walk further and longer after they've engaged in pulmonary rehab. The problem exists is when we take patients from pulmonary rehabilitation and we try and move them to the home. So after they've completed, let's say, a 12-week program, trying to get them to exercise in their home and increase their physical activity. It works if they do it. The problem is that patients often don't do it, just like oftentimes we don't do it. So we try and get our patients to increase their just simple walking or riding a cycle ergometer or a bicycle, depending on where you live, is helpful in improving their physical function. We also know that physical activity increases quality of life. So the more functional you are, the better your quality of life is, and the better that you're able to interact with your family, engage in work activities, or just general activities of daily living. Well, the mere fact that patients remain active will help decrease their shortness of breath. So we find in pulmonary rehabilitation programs that just by having patients be active, that their shortness of breath decreases. It's sort of like taking your car to a mechanic and getting it tuned up. So if the rest of your body is tuned up, your shortness of breath is better, just like if your car is tuned up, you get better gas mileage. So if we think of dyspnea in that way, just being physically active will help reduce dyspnea. But there's also other things that we can do to help along the way. We can teach patients how to do controlled breathing. So breathing slower and more deeply, exhaling longer so that they don't develop dynamic hyperinflation will also help reduce dyspnea. Distractibility also helps reduce dyspnea. So perhaps using things like music to distract patients from their perception of dyspnea will help them walk further. That's been shown in a couple of different small studies, but it looks promising. So there are things that you can do to reduce dyspnea so that you can increase physical activity. So we're becoming more and more aware that there are a lot of problems with the use of home oxygen. Oxygen helps patients improve their quality of life because it enables them to maintain activity at home. But there are problems from the time the prescription is written to the delivery of the oxygen to the home to the patient actually interfacing with the oxygen in the home. So the prescriptions need to be written in a specific way in order for insurance companies to cover them. So oftentimes you have a lot of time and effort is spent on getting that prescription written in just the way it needs to be written. Then it goes to usually a DME provider, durable medical equipment provider, and they deliver the oxygen. Sometimes we educate patients on one form of oxygen and then they get a different form that's delivered. The other problem that patients have is that, first of all, they may get a big bulky system, so a non-portable system, so they can't leave the house. They're tethered to their home, so that's an issue. Using oxygen when you travel is exceedingly difficult. You have to work with the airlines often to figure out how you're going to get your oxygen to travel. Things break and patients don't know who to call to fix it. And when you think about it, we need oxygen to breathe. So when you're not getting enough oxygen, you're short of breath, and the anxiety increases, you become panicked. So we don't give patients enough resources to deal with breakage of equipment, to figure out who to call when things go wrong. So there are a lot of efforts actually going on at the ATS to try and figure out how we help patients deal with home oxygen. A group out of the Nursing Assembly last year surveyed almost 2,000 patients to look at these issues, and they've taken that and they've gone to Capitol Hill here in the United States to express the needs of patients, and they're also working on specific guidelines. So we do things better from the hospital when they get their oxygen to transitioning them to the home. I think we can, as health professionals, we can do a number of things to help patients increase their physical activity. The number one thing is for the healthcare provider to recommend that patients become more physically active. The mere fact that your healthcare provider has recommended it will make patients be a little bit more active. There's a lot of technology out there. Some of it is useful, some of it is not. The activity monitors that we all wear, there's mixed evidence whether they really work in helping patients increase their physical activity and their steps per minute, or their steps per day. But you can give patients a goal for increasing their steps. Access to pulmonary rehabilitation can be made easier. So you can prescribe pulmonary rehabilitation for patients. Pulmonary rehabilitation is markedly underutilized, and it's often inaccessible. The programs just don't exist. So we can do that. We can try and make it more accessible. And we can also help patients reduce their fear. Oftentimes there's a great level of fear with patients with COPD in particular, but also other lung diseases, of patients becoming more short of breath. And they get afraid when they become short of breath, so they stop doing anything. And it's the use it or lose it syndrome. If you don't use your muscles, you're going to lose some of their functionality. So we want to teach patients not to be afraid when they become a little bit short of breath, to try and push through some of it so they can get the rest of their body in better shape to be more active.